Hey, Dr. Ben here with Functional Performance. Over the next 8 videos, we're going to look at a series of exercises that are focused on core and lumbar stabilization. These are indicated for people that are in subacute and chronic pain. What we expect to see with these is going to be better muscle balance, better postural control, and decreased pain. So if you are actually having an acute episode of pain, we really do encourage you to get that evaluated prior just to jumping right into these exercises. That way we can make sure that these exercises are appropriate for you. We're going to start off with a lumbar stabilization exercise. It's just an abdominal brace. So this is a good one that's going to be used for all the other exercises moving forward. Essentially it's just pulling the ribs down a little bit, tightening the abs, squeezing the glutes, locking in your low back. We want you to be able to do this in all positions while maintaining normal breathing. So that's the abdominal bracing. The next one we're going to do does not require an abdominal brace. We are going to be on our hands and knees position. It's going to be the cat-camel exercise. Here we're just exploring full range of our spine in a flexion position as well as an extension position. Drop the chin, tuck the tailbone under. Anterior tilt the pelvis, lift the chin. So 10 to 15 reps of that should get your spine feeling loosened up a bit. The next one we're going to move into is in the same position, and it requires an abdominal brace. It's the quadruped, also known as the bird dog exercise. Hands underneath your shoulders, knees underneath your hips, abdominal brace. We're going to extend opposite arm, opposite leg, without losing a stable, neutral low back. Moving on, we have the dead bug. Just opposite position, we're going to flip over on our back. We're going to abdominal brace, 90-90 position of the hips, arms up, extend one leg, one arm, and back up. Here we have long levers, arms and legs, really trying to pull our low back out of position. That's where a really strong abdominal brace is required. If this is painful or difficult, too difficult, there's a peel back, opposite arm, opposite leg supported by the floor, abdominal brace, and lift. Opposite side. All right, so 2 versions of the dead bug. The next one we're going to move into is just a side plank. Side plank from the elbow. We're going to lift, bring the hips forward, tight abdominal brace. If this creates pain or is too difficult, there's a peel back as well. Drop to the knees, lift, shift the hips forward, and hold. If this is too difficult, one more peel back, add a little extra pressure on the floor with the hand. That's a side plank. Front plank, from the elbows, abdominal and glute squeeze, abdominal bracing, and hold. Peel back if that's too difficult or painful. Drop to the knees, and hold. All right, back to our back. We're going to do a curl up. This is going to be, it's not a sit-up. We're not flexing or moving the low back. Low back stays stable throughout this exercise. We are going to have our base of our sternum as the fulcrum or pivot point. And we're going to be pivoting by pulling our ribs down and doing a strong abdominal brace. We can stick our hands below our low back. 2 reasons. One, we could make sure that we are not flexing our low back. As well, we use our elbows if we need a little assistance pushing off the ground. With this one here, we're going to try to keep our chin tucked in. We don't want to lead with our head. Keep the chin tucked in tight and back down. So this is the curl up. The next one is going to be a glute bridge. Hands up, walk the heels back. We're going to be pushing through the heels. Glutes and abs are working together. So we're going to squeeze the glutes, squeeze the abs. We're just going to tilt our pelvis posterior as we lift. And then back down. And repeat. Really focusing on making the glutes the primary movers of this exercise. Okay, so work through those. Those are a great start to a low back and core stabilization program. Now you're gonna do more reps and more sets than I did here, probably 2-3 sets. Somewhere in the 10 to 12 reps each is probably a good place to start. Let us know if you have any questions.